So today we're going to be talking about the implementation stage of the strategic prevention framework and looking at how it relates to corresponding steps from the community health assessment. So community health assessment is a systematic process involving the community to identify and analyze community health needs and assets, prioritize those needs, and then implement a plan to address significant unmet needs. This process is centered around community engagement, and it's involved within each of the steps. The purpose of the SPF implementation step is to put a community's prevention plan into action by delivering evidence-based programs and practices as intended. To accomplish this task, planners will need to balance fidelity and adaptation and establish critical implementation supports. Some key aspects of the implementation step are delivering programs and practices, balancing fidelity with planned adaptations, retaining core components, and establishing implementation supports and monitoring. So implementation is all about the actual action of delivering the programs and practices to the community as they were intended. There are aspects of capacity, planning, and evaluation directly involved with the implementation process to ensure that it is achieving its intended outcomes. So here you can see an example from the CHA worksheet that was filled out from the perspective of the state. The selected strategies are being implemented through the SPF PFS grant activities. Each strategy has a plan for tracking and evaluating to ensure fidelity and alert us to the need for any adaptations. Implementation is the actual action of doing this work, but it's good to think about how we are considering our capacity, our plan, and how we are going to evaluate that work. So a huge aspect of the implementation stage is balancing fidelity and adaptation. Fidelity refers to the degree to which a program or practice is implemented as intended, while adaptation describes how much and in which ways a program or practice is changed to meet local circumstances. Adaptations can be planned in order to improve a program or unplanned. Unplanned changes might occur during implementation, and any changes that might compromise program effectiveness need to be addressed early on. The greater the fidelity, the more likely the program will produce positive results. This must be balanced with the idea that adaptation to programs may be called for when addressing unique needs of the target audience. Evidence-based programs and practices are called that because they consistently achieve positive outcomes when they are implemented with fidelity. It is important to consider how adaptations to a program could compromise effectiveness and follow some guidelines when looking to balance fidelity and adaptation. So some of the key guidelines to think about are retaining core components. Evidence-based programs are most likely to be effective when their core components are maintained. Core components are those parts of a program or practice that are responsible for producing positive outcomes and thus the most essential and indispensable. Core components are like the key ingredients in a cookie recipe. We can take out the chocolate chips, but if we take out a core component like flour, the recipe just won't work. Understanding and adhering to the principles underlying each core component may allow for some flexibility. Build capacity before changing the program. Rather than change a program to fit local conditions, consider ways to develop resources or to build local readiness so that it can be delivered as it was originally designed. Think about how capacity building could tie into implementation here. Add rather than subtract. Doing so decreases the likelihood of core components getting lost, and keeping those core components intact should always be a priority. This is why you should try to add to a program rather than take away from it. Adapt with care. Even when programs and practices are selected with great care, there may be ways to improve their appropriateness for a unique focus population. Cultural adaptation, for example, refers to modifications that are tailored to the beliefs and practices of a particular group and enhance the cultural relevance of an intervention. To make a program or practice more culturally appropriate, consider the language, values, attitudes, beliefs, and experiences of focus population members. And lastly, if adapting a program, ask for help. Knowledge experts such as program developers can provide information on how a program has been adapted in the past, how well these adaptations have worked, and what core components should be retained to maintain effectiveness. Members of the focus population can also suggest ways to enhance program materials or messaging to better reflect their concerns and experiences. It is always a good idea to reach out for help when adapting an evidence-based practice or program. So, establishing implementation supports. There are many factors that combine to influence implementation and support the success of prevention efforts. The following are important factors that support implementation. Favorable prevention history. Individuals or organizations that have had positive experiences implementing prevention practices or programs in the past are likely to be more willing and able to support the implementation of a new intervention. It is also important to address the concerns of individuals or organizations that have had negative experiences implementing a program or practice early on in the implementation process to help them fully understand the potential. Leadership and administrative support. Prevention programs and practices assume many forms and are implemented in many different settings. However, in order to be effective, all of them require leadership and support from key stakeholders. Provider selection. When selecting the best candidate to deliver a prevention program, consider professional qualifications and experiences, practical skills, as well as fit with the focus population. Ask yourself, who is prepared to implement this program effectively? With whom will the program participants feel most comfortable? Certain provider characteristics that extend beyond academic qualifications or experience are difficult to teach in training sessions, so they must become part of the selection criteria. Provider training and support. Pre- and in-service trainings can help providers who are responsible for implementing a program to understand how and why it works, practice new skills, and receive constructive feedback. Since most skills are learned on the job, it is also very helpful to connect these providers with a coach who can provide ongoing support. The implementation of evidence-based programs and practices requires behavior change at the provider, supervisory, and administrative support levels. Training and coaching are the principal ways in which behavior change is brought about for selected staff during the beginning stages and throughout the process of implementing evidence-based programs and practices. A clear action plan. When developed in collaboration with all key partners, a clear action plan can help to ensure that everyone involved in implementation is on the same page and no key tasks fall through the cracks. A clear action plan includes all implementation tasks, deadlines, and people responsible. More details regarding action plans will be discussed on the next slide. Implementation monitoring. By closely monitoring and evaluating the delivery of a program or practice, planners can make sure that it is being implemented as intended and thereby improved as needed. By assessing program outcomes, planners can determine whether a program or practice is working as intended and is worthy of sustaining over time. Assessment of provider performance and measures of fidelity also provide useful feedback to managers and implementers regarding the process of implementation efforts and the usefulness of training and coaching. This ties into the evaluation step and will be discussed more during the next presentation. These implementation supports are interactive, and they can compensate for one another so that a weakness in one can be overcome by strengths in others. Organizations are dynamic, and there is an ebb and flow to the relative contribution of each support to the overall outcomes. Implementation monitoring can help to reveal which supports need to be adjusted to improve effectiveness or efficiency. A clear action plan includes all implementation tasks, deadlines, and people responsible. Look to address the following questions with your action plan. What specific, concrete actions are needed to achieve stated objectives? What specific changes need to occur? What organizations or individuals will take the lead on each action step, and who will be responsible for ensuring completion? Who else will participate, and what roles will they play? What is a realistic time frame for the implementation of each step? When will the implementation strategies be completed? How will they be maintained? How will you measure and track progress? Are your measurements culturally competent? Is the plan flexible enough to adapt to changing circumstances and challenges? How will you continue to involve community members throughout the process? So with an action plan, you want to be specific with all of the details and select actions that can be tracked and measured while always planning to involve community members in that process. So as always, we're going to wrap up these presentations by considering how we can focus on the SPF guiding principles of cultural competence and sustainability, and how those can be applied throughout the implementation stage. Here are some ways to integrate cultural competence into your work throughout the implementation stage. Implement prevention programs that target populations experiencing behavioral health disparities. Involve members of these groups in the design and delivery of those programs. Understand that people may choose to participate in different ways and that they may also have different learning styles. Adapt and/or tailor evidence-based practices to be more culturally relevant. For example, create an in-person version of a training that was originally designed to be delivered virtually so that it can be accessible to audiences with limited online access. So thinking about these concepts, we can see why emphasizing cultural competence throughout our capacity building and planning, bringing the community into the process, listening, and involving them with planning can go a long way towards ensuring that cultural competence is integrated throughout implementation. Sustainability is the other guiding principle of the SPF, and here are some ways to integrate sustainability throughout the implementation step. By working closely with community partners to deliver evidence-based programs and practices as intended, closely monitoring and improving their delivery, and celebrating small wins along the way, planners can help to ensure their effectiveness and begin to weave prevention work into the fabric of their community. So this goes back to some of those implementation supports that we are working to establish. The more established those supports are, the more likely a program or practice, and ultimately the community outcomes it influences, is going to be sustainable. Thank you for your time today. That wraps up our presentation on implementation.